and welcome to another evening of frank conversation here on Hard Copy, coming to you from our studios in Abuja. I'm Maupe Ogun Yusuf. For those who are avid observers of world politics, it's hard to ignore the developments in the United States of America, particularly if they could directly affect events back in your own country. One of such developments that has been hard to ignore is the current state of affairs around the U.S. Agency for International Development, also known as USAID. Although it's unclear what will become of the agency, a lot of African countries are apprehensive about the support they rely upon to fund critical sectors of the economy, one of which is health. The United States is said to have committed up to $20 billion in the health sector of African countries since 2021, with about $600 million coming to Nigeria in 2023 alone. Should Nigeria be one of those apprehensive about this development around the USAID? And how will it affect our fledgling, or shall I say, our developing health sector? On Hard Copy tonight, I speak with one who should have answers. Professor Ali Pate is Nigeria's Coordinating Minister for Health and Social Welfare. Honorable Minister, welcome to Hard Copy.
Thank you for having me.
You know, every time I speak with you, I've only spoken to you on my sister program, Sunrise Daily. You're always very optimistic about Nigeria's health sector. But every time we look at the pages of the papers or we go to the hospitals, it's hard sometimes to be optimistic. Where do you derive your optimism from?
I think I'm a realist. In the context of the work that we are doing, the fundamentals are there. There's political leadership. Nigeria has the resources, human and financial resources. And the direction that we have taken in the Health Sector Renewal Investment Initiative gives me confidence that we have set the right direction, and that if we execute it collectively, federal government, states, local governments, Nigerians overall, we can build a health system that will serve all of us. It requires us to be optimistic, to bet on a better future for this country, as opposed to hang on to deep-seated cynicism. Admittedly, Nigerians have had reasons over many years to be despondent, to think that nothing will work, nothing is good in this country. But there is a new era that is being ushered, which if you look carefully, you'll see the trajectory of the country is beginning to shift. And for someone like me who is observing this and with the experience that we have in this country and elsewhere, I'm confident that if Nigeria collectively, if we steer the course in this direction over time, that we will see a very different and transformed healthcare system that we will be proud of. Nobody will do it for us. It's us Nigerians that will do, and we have to first believe in it. So that mental threshold has to be crossed.
What would you say the challenge really has been? Because it's not like I say we do not have the professionals. Some people will say we have had health ministers who have been up. You have been health minister before now. So precisely, what do you think the primary challenge has been with Nigeria's health sector?
The fundamental issue is that we have not invested seriously in our health infrastructure, in our health human resources, in our equipment. We have not come together as a nation to build a national health system. Federal government had its path, states had their path, local governments, some pulled more than others. That had been over time, and government's revenue as a portion of our GDP has been very low. So of the little that government is able to collect, it had prioritized health much lower, education much lower. But this president, in his renewed hope agenda, had put human capital as a core, and we have seen deliberate effort to invest more in health and use what we're investing, little as it may be, use it well and target it to service delivery. And we've begun to see the impact of those slowly happening, but it will take time for a system that has spent years without the required infrastructure and equipment and the human resources being attended to, supply chains, consumables, product. It's a system. That system will take time to get to the point where people will see a much larger transformation, which is possible. When folks think about UK or US healthcare system, where many of our compatriots go, those systems spend a large chunk of their resources. UK, more than $4,000 per capita in health. Here, we're talking about $120 per capita total, of which public financing is about 30% of that. So you can look at the disparity. The United States, for instance, about $14,000 per capita. So healthcare is not cheap. Quality healthcare is not cheap. You have to invest in it. We as a country had not invested in it, and yet we had been asking for highest quality health. The few elites afford it, they go out. But domestically, we had not invested. Now we have seen that change in the last 18 months with a deliberate effort to improve the investments and to allocate the investments where it matters. The foundation, the primary health care, the higher level health infrastructure, the cancer infrastructure that we're rebuilding, the teaching hospitals, the equipment, the human resources, the expansion of the training, the regulatory side, the harmony in the sector, and the production of the commodities that we need to deliver, whether it's antibiotic. Can you believe that more than 70% of our drugs, generics, we import them with foreign exchange that we didn't really have? So if we can flip it over time, 99% of our medical devices, we import them. Now, if we flip that over time, and that is not going to take place overnight, but we have to be on that path. What we're trying to do is to change the trajectory, and we're beginning to do that. First, it requires political will, and we have seen it. The President unveiled his health sector renewal investment initiative, and we saw 36 state governors join the federal government and signed a compact. We've seen deliberate effort to mobilize resources to invest in health. And just last week, the Federal Executive Council approved almost $1 billion in terms of concessional financing from IDA for the HOPE program. That is significant resource which states will implement, will have incentive. It's a program for results which will deliver better, but it will take time. The starting point is us Nigerians building the consensus that health is one area that affects all of us, and that we join hands and make the right investments and execute them so that we can have the health system that we desire. Complaining on the sidelines and thinking that, oh, things will not change or things are so bad, it's not going to get us there. We're acting in that direction, and I believe many leaders are keen into that because all the 36 state governors have now expressed interest to join with the federal government in this journey. If we can sustain it on the public side and enable our private sector actors, the private sector hospitals, the providers, the pharmaceutical industry, to also rise up, we'll have a healthcare system that will serve Nigerians and potentially even serve other parts of our continent.
Yeah, it's a big if. I mean, you say if we can. So it's a big if.
If you look at the total health spend in Nigeria, the total health expenditure, 30% is public, 70% is private. Most of it is household out of pocket.
Okay.
Of the 30% that is public, about a third of that, $10 or less, is the external financing. The balance is from federal government, states, and local governments. So the bulk of the healthcare expenditure in Nigeria is on households and private sector and public sector contribution. That's not optimal. That's why we're expanding health insurance to improve the risk pool so that the burden on households gets lowered, expanding the public component, and of course use whatever external financing that we have, but not be dependent on it. So the component of overseas development assistance for health is not the largest chunk of our health expenditure.
But has it been significant?
It has been significant.
How significant? What is the percentage?
We're a large country. We're a very large country. And while we talk about the total health expenditure overall, and the 70% that is private, that is domestic private, and the 30% that comprises the public as well as the overseas development assistance, I would say about $6-7 per capita is what the external development assistance is about. Now that is about $6-7 per capita. If you multiply by 230 million Nigerians, That's about the figure that I will say that total. Now, the US government, as a key component of that, it is a key component, has been for a very long time, but it's not the only one. There are others, the UK government, other development partners contribute. Some are technical partners, WHO, UN partners, they contribute, and we appreciate. It's not only about the money that folks bring, but some bring technical expertise, and we appreciate it. The US government has contributed significantly, for instance, on HIV, on TB, or malaria, but much of those resources are not channeled through government systems. They're channeled through implementing partners outside government. And that is the risk, the vulnerability, and we're seeing that unfold now.
So are we at risk then? I mean, how vulnerable are we?
So for us, we are not complaining. We're full of appreciation to the US government for the contribution they have made. The American people have contributed in taking care of more than 1.3 million Nigerians on antiretroviral therapies, tuberculosis, malaria, maternal and child health conditions. The change in US government policy is the change of US government policy. That is the determination of American people. We can't complain. What we have determined is that we are primarily responsible for the health of our population. And we are going to work towards exiting the dependency on external assistance, particularly in view of the transition that the US government has made. While appreciating what the US has done, we know that there may be other ways that the partnership between Nigeria and the US government will continue. We spent time to analyze the quantum and the support that had been provided outside government, and to do a bottom-up costing if we were to take that as the public sector. And we now have completed that assessment of what it will take for HIV, for tuberculosis, and for malaria. And as you recall, at the Federal Executive Council, the President set up a committee, a cabinet committee, Minister of Finance, Budget, myself, Minister of State for Defense, the Governors Forum, to think of that transition so that government, as a responsible government, we own this problem. It's our population, and to ensure that we don't lose grounds on that. We've assessed what is on ground, and we have determined a quantum of resource, and we will identify where to source that so that we buy the commodities and buy them in such a way that we encourage those who are producing them to come and produce in Nigeria as well, because that is sustainable in the long run. To look at the supply chain, how do we manage it in our own context? And when we look at it with a lot less than the total quantum of the US government contribution, we can be able to at least support our population. We may be a poor country, but we are a capable country, and we are determined to own up on that responsibility. Now, if others step in and support us, we appreciate it, but we are not begging for it, and we also will live within what we have, but we have the responsibility on us as leaders to ensure that our population gets the care they need. Federal government is going to do its part. Now, states, we expect that they will also step in, because there are many things which happen at the state level on HIV, on TB, on malaria. There are health workers, 28,000 of them, who were being paid through the US government's support. And while it has been appreciated, but those health workers are Nigerians. We have to find ways to transit them. At the end of the day, our approach long before the change in US policy has been towards increasing national ownership, increasing domestic resources, improving our healthcare value chain, and producing what we use, strengthening our resilience through surveillance, laboratory systems, so that we deal with infectious diseases. We never really, let's say, absolved ourselves of the responsibility for taking care of Nigerians who require government support. Health is a right, and it has a value inherently, and is key to the future prosperity of our country. So the pivot that the US government has made, in a way, found us where we had already been moving in that direction, and it's just about raising the additional resources to be able to cope. And we are confident that Nigeria can be able to cope. It may not be able to buy the most expensive versions of the medications that the US dollars are able to buy, but with the resources that we have, I believe that we can find those who have those medications, generic as they may be, but with the quality that is needed, that we buy and distribute to our population, and we want to safeguard the progress that has been made on HIV.
Let me bring up this issue, because you've talked about how, you know, yes, a lot is being done. You are confident that things are moving forward. And I'm sure viewers will say, oh, yes, she did say that he's always very optimistic. But let me look at a number of other issues, you know, which, you know, sometimes put holes in the optimism. I'll give you this instance of, you know, the electricity situation, for instance, in UCH. It has remained intractable. It's over 107 days now. We're still counting. This renowned, well-known hospital, you know, the days of yore, is still, you know, in darkness.
Yes.
What is happening?
Yes. So excellent question. And just as I was coming into the studio, on your byline, you had a point that the power minister promises to rectify the power situation at UCH. But let me tell you the backstory. This has been a story for several years of accumulated debt to the Ibadan disco. And the hospital was disconnected, was reconnected. We stepped in to help the hospital. But the chief medical director over the last 3 months has done an incredibly good job that people may not want to acknowledge of transiting to off-grid power. Solar, he has solarized many of the wards, theaters, GOPDs, and he developed a mechanism whereby there are hours of when he would use diesel for theaters to operate. So it's not as if the hospital wasn't functioning. It was functioning within certain bounds and using off-grid resources to power the hospital. And when we finish, I can show you the pictures of UCH at night 3 days ago with light. It's not as if they are in darkness. And the logic that he said to me, look, I want to have an alternative, a backup, so that I negotiate with the Ibadan disco to pay some of the debt over time, and then they can reconnect us. The challenge that he has was the UCH power was connected to University of Ibadan. There are private entities within the university. So the University College Hospital was paying for bill of what it consumes, as well as others, including residences that are within that perimeter. So disentangling that, how can the hospital bear the burden of including residences of those who are not necessarily working in the hospital, not only the clinical side, and also private entities, or even the university? We are determined, and I tell you, if you go to UCH, if you call the CMD, he will tell you, the hospital functions, its theaters function, they operate, there are patients, and I can show you live recordings of those of the hospital just 3 days ago. The issue of transformer that they are looking for, the power minister is working very hard to ensure that they get the transformer so they can disaggregate what the hospital has and what other parts of the hospital has. And in 2025 budget, not only UCH, almost all our hospitals, we're working through the Energy Commission and the Rural Electrification is to solarize them so that we use alternative power sources to power our facilities, because the cost of diesel is encroaching on their internal generation revenue. Our CMDs have been struggling with that, and we're trying to bring relief. We are about solutions, not complaining. It's easy to complain, and there are many who will just complain. But what we're trying to do is to provide solution, and the solution is a combination of things. Of course, these are private entities in terms of discos, the GENCOs, but there are also off-grid solutions like solar that we need to bring, and ensuring that the hospitals are able to prioritize. There are some hospitals that are completely, we're able to have off-grid sources like Maiduguri. University of Maiduguri Teaching Hospital can exist without the disco, because they have an off-grid solution, they have an IPP. There are many other ways that they've been able to manage. We want many of our hospitals to be sustainable. These are painful things, but we are going through so that our hospital will be in a good place to continue to deliver the services. In the last 2 weeks ago alone, 3 MRIs, 2 CT scans had been approved by the Federal Executive Council to be purchased in some of our teaching hospitals. The massive upgrade of the cancer centers and the infrastructure, the equipment of those facilities and our teaching hospitals. So the conditions within which our health workers operate is going to improve. Now, it is not easy to just change a system that was decrepit for a very long time. But we're taking those steps. And what I will urge our compatriots is to think positively that there is something good that is possible in this country. But it is us that will have to make it happen. There are no angels. When you go to America, you go to UK, I've been to those places. They built the healthcare system themselves. They paid it themselves. So if you want to see a good healthcare system in Nigeria, dig in, come in, see what you can do, whether public sector or private sector. And
the state governments are buying into it, and local governments?
They signed a compact. For the first time, we had an unveiling on December 12, 2023. I signed, all the 36 state governors signed, the President, His Excellency, President Bola Ahmed Tinubu, witnessed it, signed in public, that had a compact that governed how we collaborate among ourselves. And that is the way to move forward. So it's not just the Federal Ministry of Health on its own.
Yeah, so the question will be, where are some of the areas where you're looking to see this cooperation? Where should Nigerians be looking to see the fruits, the manifest? I mean, everyone can sign anything. No. The manifestation of this particular compact.
So is the primary healthcare system getting better? Is it revitalized? Are the services being delivered? And there are 8,800 facilities across 36 states that are receiving funds through the Basic Healthcare Provision Fund. These are not federal facilities, but it is federal resource that we're sending to them. We've retrained 56,000 frontline health workers. They are not federal workers. They are workers at the primary healthcare centers. We are revamping the Comprehensive Emergency Management Obstetric Centers, CMONC facilities, expanding health insurance, providing coverage for emergency obstetric services. These are services happening in Nigeria.
Yes, the health insurance which you just mentioned now, are state governments also signed up to that, or they're also having to run theirs?
They have their state health insurance authorities, and they complement what the federal government is doing. Now, the Basic Healthcare Provision Fund, which is a federal contribution, goes through the states as well to the centers, which receive the resources to cover the population in those areas.
How long do we have to wait to see the fruits of the compact?
I think, so first of all, Nigeria has waited at least in this Fourth Republic 25 years. We're 18 months into it, and we're already beginning to see the results. In the last year alone, when we did the MOC, the Ministerial Oversight Committee, more than 10 million Nigerians access services in BHC facilities. More than 1.5 million women delivered in BHCPF facilities. So there are millions of Nigerians that are accessing services in the facilities. They are state and local government facilities.
That was before the compact. Now that we have the compact.
No, the compact was signed 2023. Oh. And in 2024, we had a review.
1.5 million.
And we had assessed those who had delivered, and we had assessed those who have been served, 10 million. And you recall we had a joint review. So we are on a path, small as it may be, and that we should build on it. I have to tell you.
What about if Nigerians see where it is not really happening? How can they tell you?
Tell us.
How do you get feedback?
Through various channels. Through various channels. We track. The perception survey is one, for instance, that we systematically, but we also track through other mechanisms, and we get feedback, and we respond to that. We are not perfect. We're not pretending that everything is good. And wherever we see a problem, we try to solve them. That's the difference. There are some who are only looking for a problem and to complain about it, but we are not. We're saying, where it is, we'll fix it. You brought USH. We've been trying to hunker down and solve it. And that's what we'll continue to do. What I urge our compatriots is to think positively of this country, that this president is trying to take us somewhere that will be good for this country in terms of its prosperity and its future. But he cannot do it alone. The Minister of Health cannot do it alone. It is all of us, including the private sector, including the media, that will work on the psyche so that we appreciate what is ours and that we build it. But Sharing down Nigeria and say, oh, it's not, all this, it's counterproductive. For us, that's not the mission. Our mission is to improve the health of Nigerians. And we are going to continue to do it, and will surprise even those who are saying, oh, it's not happening, because it hasn't. If it was easy, it would have been done before. But we're working very hard, and the president is backing us. And we have many others in this country who are supporting that, and there are many Nigerians out in the field who are benefiting from this service. I have seen them, and they are very, very appreciative of what this president is doing.
Honorable Minister, we certainly hope to catch up with you again, hopefully on this program, to track progress. Thank you for coming on Hard Copy.
I'll invite you to visit some of those places. You can go to Bauchi, you can go to Kano, you can go to Ebute Metta. There are many places in this country that you can go and see for yourself. Not in this studio. Thank you.
Thank you for coming on Hard Copy. Well, that's the program tonight. If you'd like to share your thoughts on some of what the minister has shared, please use the handles showing on your screen. Thank you for watching. I'm Maupe Ogun Yusuf. Good night.